Okay, I'm going to show you how to do a catheter today. And first of all, you need to explain the procedure to your patient and tell them what it's for. And it really helps if you talk to them along the way because they don't feel discomfort. Of course, this is just a mannequin, but we're going to use this right here to insert this. And one thing that I tell people who I'm teaching is just a simple courtesy is pull the sheet up so they have something to hang on to up here instead of pulling it down where they're completely exposed like this mannequin here. So it just gives them a little sense of security. You're going to take your catheter out. You can take this bag and you can use it as a trash can, and you can set it on your bedside table, or if you have another place you can set it there. Put it off to the side where it doesn't fold over on itself. And then you're going to open it away from yourself, because just imagine your body having a bunch of germs falling off, and you don't want the germs falling over the sterile field, so you want to open away from yourself. And then the last one is towards yourself. Remember now that this area in here is sterile, so you don't want to smooth it out or anything like that, because I've just contaminated the whole field, so you don't want to do that. If you need to straighten anything out, straighten it out from the edges so it's still sterile. Now you have a drape. Your first drape here is a barrier drape, and you can pick it up on the very edge with your hand, or you can have just a clean gloved hand. You see how this side is flat and this side is kind of shiny like that? You would want to put the shiny side under the patient on the bottom, because the flat absorbs fluid. So you want to be holding it by these two areas right here, and just ask your patient to lift up, and there you've not touched any of your sterile field yet. You see that's touching that, so you can reach under and pull this back a little bit. Then the next thing you need to get is your gloves should be the next one. So get your gloves out, and you put them on sterilely, holding underneath on the first one and under the cuff on the second one, so you don't contaminate the gloves. And then you have a second barrier sheet, and this can be used a couple different ways. You can open it completely up where the hole is in the center, like this. Sometimes you don't have room to do that, and you don't even have time to use this right here. You just have to keep the sterile area right here. And sometimes you can just open it part way up to keep a barrier between you and your patient, because sometimes when it's open all the way up it will kind of fold down. So let's open it part way up for this so it can be a barrier. Only touch the top half so you're not contaminating underneath. Now you have a little plastic thing here, drawer here, and you're going to take your catheter out, set it under there. This is for a urine specimen if you need one. So we're not going to use that right now, so I'm just going to put it off. This box, you can leave it here, but remember your patient's legs are going to be here, and usually their feet are together right here, and then their legs are kind of up and spread out. So you can take this off, and this could potentially be used as a trash bag if this falls off or something. So now you have this left, and you have in your little tray, you have three things you need to do. First of all, you need to get your hydrogen peroxide, your cleanser, open it up, and pour it over your cotton balls. And then just dispose of it. Secondly, you have your lubrication. You can tear that open. And And before I lubricate anything, I'm going to test the balloon on the patient. Oops. Little air in the top there and it kind of squirted out. What you want to do is twist this together so it doesn't come off, and hold the end of this and squirt this water into here, and this fills up the balloon, which is going to hold it in the bladder. And this is what holds the catheter in place. Then you're going to let this come out so you can get it in the bladder, and leave this syringe on here. At this point, you can put the end of this into the lubrication, so it kind of keeps it from getting contaminated, and it also makes it ready for when you're ready to put it in your patient. At this point, you take, this hand is established as your dirty or not, and it's also your non-dominant hand. So if you're left-handed, you need to be standing on the opposite side of the bed. You take your left hand, you open the labia up, and you're going to take your first cotton ball, and you go to the outside, the side away from you, and you're going to swab from top to bottom, because you don't want to bring any rectal feces or anything. You don't want to bring anything up from the rectum up this way. You want to cleanse from top to bottom like this, and then go around your sterile field and drop it in your trash. Another one from top to bottom on the far side and around your sterile field. The next one, you go to your near side, top to bottom, around your sterile field. You do this once again, from top to bottom, around your sterile field. And then, since you're putting the catheter right there in the middle is the last place you go, and you go from top to bottom, straight down the middle, bring it around, and once again, straight down, bring it around. And then drop your tweezers, because they're probably kind of contaminated by now. At this point, you will take your catheter, and it should be lubricated, and you are going to place it in the patient. Once you put it in the patient, to make sure that it's in the right area, if it's in the bladder, you're going to see what's called a urine flashback, and the urine flashes back right in this area here. And then once it flashes back, you advance your tubing another 2 to 3 inches at least. And sometimes you'll see a person in the hospital advance this tubing just as far in as they can. But what happens is, because of the lubrication, it will inch its way out, and then whatever was on the inside of the patient is out here. So you don't want that to happen. So again, you're holding up here, you get it in, and then you can let go with this hand, not touching any of this. Come around, push your solution in to where it's just holding pretty good, and before you let go with this top hand, you want to give it a little tug to make sure that it's staying in. So what you want is for all of this solution to be pushed into this area to hold it into the bladder. Once it's pushed in, you can disconnect it, throw it away. It's done, and it should be flowing. You can connect it here with tape and leave a little slack here. Connect it with the tape on the inner thigh. And a lot of times different hospitals will put it on the lower abdomen for the male, the inner thigh for the female. Go by hospital protocol. And you're going to hang this to gravity on the bed frame, not the bed rail. You hang it with this little thing right here. And then to empty it, you take this out, you push that to one side, drain it into a container, and then just make sure that you put it back up here so it doesn't leak. But you'll be hanging it down here on the bed frame. And that's how you put a catheter in.